Hello and welcome back to my pregnancy video log. I'm Amber from LoveFit and She, and yes, I am currently just over 15 weeks pregnant, so this is the second video in the series. And what I wanted to show you today was a few things you can do to try and release tightness across the chest and strengthen your upper and mid back. So a lot of women, most women to be honest, present with what we call upper cross syndrome during their pregnancy and certainly in the postnatal period. This is where, I'm just going to turn sideways so hopefully you can see better, but this is where the muscles in the chest tend to get shortened and tighter from the increased weight of growing chest and growing belly. So things start to move forward, and then all these muscles in the upper back start to get weaker and more stretched. And obviously we want to try and maintain a nice posture, not least because it looks better, but also because you're far less likely to present with pain. So I actually last week, towards the back end of last week, did start to get a little bit of back pain just in my mid back. This is probably actually unrelated to my pregnancy. Some of you know from those of you who read my blogs that I had quite a nasty injury to my spine earlier this year. So I've got a bit of a weakness there, and it's something I've been working on really since March, and we're now in late October. But that has caused me quite a few issues with my body. And I think I was on holiday last week and sleeping in quite a hard, uncomfortable bed, and I think actually that's what has caused the back pain. But there are various things that you can do to help, because as I say, back pain is quite common in pregnancy due to the changing centre of gravity, things growing, and maybe not looking after yourself as much as you normally would. So the first thing is, before we actually look at working these upper back muscles, we always want to release the tight area first. So we're looking to release, as I say, across your chest mainly. So what I recommend is using one of these bands. You can use any kind of band. You can get ones that people use for assisted pull-ups. You can use one like this, which is essentially just a physio band. I think these ones are from TK Maxx. You can use anything really. But one lovely exercise I like to do is, if you hold the band right towards the edge, you've got it really nice and wide, and then keeping the arms completely straight and trying to keep your shoulders away from your ears, you take the arms up and back over the head and just back as far as you can until you feel this stretch across here. So you might be able to get right back there, and then just bring it back. And the key to this is to make sure the arms stay straight. So if you hold it too close, you're going to find your range of motion is quite limited, and you don't want to be trying to contort yourself. So take it wide, take it up, breathe out, and bring it forwards. And this is something I do with a lot of my clients anyway, regardless of whether they're pregnant, postnatal, or completely not. Just because it's a great way of releasing those tight muscles. This is great for anyone who spends a lot of time working at a desk or driving a car. We all end up in this forward hunched position. It's great after having a baby too, because you spend a lot of time feeding and carrying the baby. So this really opens you up. And I would definitely recommend you spend some time doing this during your pregnancy. So back and forwards. Another thing you can do is either lying across a ball like I'm sitting on now. I'm mainly sitting on this just because it's the right height to talk to you, or lying on a foam roller or a rolled up towel or mat. But if you get yourself, and I'll just show you this, hopefully you'll still be able to see me, if you walk down so that your chest can expand and take your arms out to the side like so, and you can do this lying on a foam roller. I won't show you now, just because I think I'll be out of shot. But holding that here, allowing the head to relax, and I can just feel all these muscles kind of under the armpit, really relaxing. So yeah, and then to come up from there, I'm just going to allow myself to roll down and come back into shot. You'll notice I avoided just sitting up there, which I might otherwise normally do. That's to try and protect my abdominals. Right now, my stomach, as you can probably see, is not looking massively pregnant despite being 15 weeks. But as that bump increases and my abs start to stretch, I really want to look after them and make sure I don't increase the chance of getting a separation. So it's really good practice to not sit up and do any crunching movements. So you've got the one with the band and this lying down either, as I say, on a foam roller with your spine at one end and your head at the other, or lying over a ball, and just allowing that stretch to happen so that you open up these muscles. Then, once we've released those muscles, we can look at trying to strengthen some of these mid and upper back muscles. So there are a few things you can do. One that I really like to do is, again, using a band. You can use any kind of band. Taking hold of it a little bit tighter this time. And you're going to take the arms above the head and maintaining a nice straight back. You're going to pull the band down behind the head, bringing the arms down just below 90-degree bend, and put it back up. And I'm going to exhale on the exertion. So I'll inhale to prepare, and then exhale there. Just pulling that down. And as I pull down, as the band comes down, I'm just gently keeping tension. I'm not trying to pull the band out, just keeping it tense so that my upper back and shoulders are getting a really good workout here. Okay, so that's one exercise you can do. Another one is using a band like this is to do a row. So pulling both arms back. If I show you from a sideways position, you'll be holding onto the band, and then you will pull back, squeezing the shoulder blades together so that you're working these muscles here. So you would need to hook this over something. I don't have anything handy right now, but if you imagine I'm sitting on the floor with my legs out in front of me, and I squeeze, and again, exhale on exertion, inhale to relax. Like so. So just to clarify, I'm not recommending you sit on a ball with one leg stuck out in front of you. I'd recommend you sit on the floor, or you can stand and just hook the band over something, so over a banister or a heavy chair that's not going to move when you pull. And one other little exercise you can do with the band, they are very useful, is just holding it in front of you, kind of belly button height, and just gently pulling the band apart. Just squeezing. Again, we use the breath. Pulling that out to try and work our lats, these lovely muscles here. And this actually really engages your abdominal muscles without the need for these kind of crunching movements, which are going to put a lot of pressure on your abdomen. And we really want to avoid increased pressure during pregnancy, because you're much more likely to end up with pelvic floor dysfunction and, as I say, a separation known as diastasis in your tummy. So this is a great way of getting the abs to work without you actually doing any kind of crunching, and it also works, as I say, the shoulders, the lats, keeps everything working there. So there are a few exercises you can do with a band. I really recommend you get one of these. I say I think these ones are from TK Maxx. You can pick them up from physio supplies, or you can get the more durable ones online at places like Bulldog Gear, Wolverson Fitness. They all sell the bands, which are more like the complete elastic band, but you can use them in the exact same way. One thing just to stress again, of course, and I have mentioned this before and I will mention it again, so apologies if you get bored, but every pregnancy is going to be different. And you can take two people who are both really fit, they're still going to have very different experiences in their pregnancy, whether that's how they're feeling, how their body responds. Some people are going to get a big chest and a big bump pretty quickly, other people that won't happen till much later. Some people go very lax, you suffer from hyperlaxity when you really don't have much support and strength in your muscles, so certain movements are going to be really not advisable during your pregnancy, and other people aren't going to have that. Other people are going to be very stiff and locked up and actually need to relax. So without knowing your specific situation, I can't tell you exactly what you should and shouldn't do, but the exercises I just showed you should be suitable for most of you. There's really no reason they won't help keep that lovely posture. One other exercise I've been doing, but this would depend on your situation, is to use a kettlebell to do a one-arm row. So I'll show you that in a second. If you're not used to using kettlebells or not training with weights regularly, then now is not the time to start doing that. Stick with the band, it's going to be easier for you. But let me just show you, if you are used to weight training, I have dropped my weights a lot. I'm not going to be going heavy, again, just because using really heavy weights will increase intra-abdominal pressure, and while there's no harm whatsoever to the baby, it's more about me respecting my body and wanting it to stay functioning really well. I'm not looking to get mega strong now. I just want to stay really fit and healthy for me and the baby during the pregnancy. So, last one to show you. I'm just going to move this, and hopefully you'll still be able to see, is using a kettlebell. I've just got a light 8 kilo bell here. You will do what we call the lawnmower, or a single arm row. So I support my weight on the opposite leg. I keep my spine neutral, so I'm not looking forwards and craning my neck. I've not got my head dropped off. And I'm going to and release. Pulling that arm up next to my armpit, so my hand ends up next to my thigh, next to my chest, ignore thigh. Hand ends up next to the armpit. My arm is brushing past my rib cage, so I'm not pulling the weight out here. I'm keeping really nice and close to the body. Okay, and obviously you do that on both arms. Most important thing is that you work within the realms of what's comfortable for you, but if you have had any niggles in your back, then I would definitely recommend releasing the chest, and I would obviously recommend then trying to strengthen the mid-back using some of those exercises. And it goes without saying, of course, that if you do have any major back issues, then please see a specialist therapist for that. So whether you see a chiropractor, an osteo or a physio, sports massage, obviously make sure they know that you're pregnant and that they are experienced working with pregnant women. Otherwise, you might end up worse than you started. Okay, so if you need any help with any of those, if you've got any questions, drop me a line. And yes, let me know your thoughts if this has been helpful, and I will see you next week for the next instalment. Thank you very much for watching. Bye.